Thank you, Mike, for this kind introduction. My only conflict of interest is I was a speaker for ESI this year. So as you know, molecular targeted therapy has been used for many years now for the management of patients with radioactive iodine refractory progressive metastatic thyroid carcinoma. And there are 2 randomized clinical trials that have shown efficacy of these drugs in thyroid cancer. The Decision trial that used sorafenib against placebo in these patients, and this is a SELECT trial that used lenvatinib against placebo, both of them showing significant improvement in progression-free survival compared to placebo, and the SELECT trial also showing an improvement in a decrease in progression events. Now, until recently, we have not been able to show a significant improvement in disease-specific survival, despite the fact that we have shown an improvement in progression-free survival. And part of that, this is a very nice trial that is actually part of a SELECT trial that was able to show a significant improvement in disease-specific survival against placebo in only the older patients, but not in the younger patients less than the age of 65. But part of the problem is that in this trial, they were allowed to actually have crossover from a placebo arm to the treatment arm, and this may have actually diluted the results of that trial. But it is very important to actually be able to show a survival benefit, because these drugs are not the easiest drug to take. They have a lot of side effects. They affect the patient's quality of life. They do require multiple drug interruptions, or sometimes dose de-escalation, and they're actually very, very expensive drugs. So it is important for us to show not only that we are able to shrink the tumors, but also that we are able to extend the life of the patients, and that it would be worthwhile for the patients to be actually treated with them. In 2016, or thereabouts, Mike and I were actually thinking about who are the patients that need to be started on molecular targeted therapies, and who are the patients that we actually can watch. And there are multiple things that you can take into consideration when you're actually making that decision. There are some patient factors, such as the patient's symptoms and the patient's age and comorbidities. There are some tumoral factors, such as the tumor location, the tumor burden, and also the tumor growth rate. And these all should be balanced against the potential benefit and risk ratio of the drugs, as well as the patient wishes. Now, when we look at survival from radioactive iodine refractory metastatic thyroid cancer,